So thank you all so much for joining us for our question and answer session to wrap up Mental Health Month. I'm Emily Mire. I'm the Director in the Office of Care and Civility in the Division of Student Affairs. Our office manages all of the non-clinical case management for students of concern at the HSC, in addition to doing all of the wellness and prevention programming on campus. And I'm really excited to have with us Dr. Franks. So Dr. Franks, do you want to introduce yourself?
I'm Dr. Susan Franks, and I am an associate professor in the Department of Family Medicine within TCOM, and I am a clinical health psychologist licensed to provide counseling and therapy to patients with all kinds of stress issues. That's kind of my area of expertise, is in stress. And for those of you who don't know me, I also work with the first and second year medical students in their first 2 years of medical education.
Wonderful. Well, we're just going to hop right into all of the questions that were submitted. So the very first question that was submitted is, what are some of the signs of mental health problems that you can easily identify? And then how do you go about connecting someone to the help that they may need? So what are your thoughts on that, Dr. Franks?
Well, usually I try to, when I work with people, I'm trying to recognize signs that they are approaching, stress levels where they need to seek help, as I like to think of it as your own sort of personal stress profile. And so I try to divide those types of signs or symptoms into 3 areas. So we have your physical symptoms and your emotional symptoms and your behavioral symptoms. So physical symptoms might be getting headaches or like tension in your shoulders, sleeping too much or not being able to sleep at all, changes in appetite, so you're eating too much or not eating much at all. So those are some of the physical signs that we think of. And then emotional signs would be like irritability, being more easily frustrated, getting angry, feeling overwhelmed, feeling nervous. So some of those are the emotional signs. And then the behavioral signs, because sometimes we're not always aware of how we're feeling emotionally, or we kind of write off the physical things as something else. It would be like arguing too much, crying, maybe not wanting to be around people, withdrawal, drinking too much alcohol, or using other ways that are not healthy to cope with stress. And so those are some of the behavioral signs that people think that are associated with stress.
Yeah, so I think in a really similar fashion, whenever we teach the QPR curriculum to students, we kind of categorize that as what you see, what you hear, and what you know. And it kind of helps you to take a 30,000-foot view as to what's happening with that person. And then whenever you go to express concern, it's not just, I'm concerned for you. You have this way of being able to summarize really concrete things that you're seeing or you're hearing or about that person that could warrant an opportunity to maybe connect them with different resources.
I think that's really great. Some people, but it's also being able to take that and apply it to yourself. Right? We're always easy to point out what's going on with other people, but sometimes we don't take that same information and think about it in relation to ourselves.
Absolutely. So what are some strategies to connect people to help that they may need?
For yourself, it's really to be able, first of all, to be honest with yourself and be able to reach out to people. So I think reaching out just to your best social support network, trying to be open and honest enough that it's okay to talk to people, finding somebody that you trust, that you can express what you're feeling. And hopefully if you can't find the resources, they can. Connecting with your doctor, finding out what they recommend, going online to websites that have information that tell you about stress or link you to resources. Those are important also. And then on campus, it's actually connecting with your office and finding out some of the things that they can do to help themselves.
Absolutely. And I think for those who may be wondering, like, how do I connect my friend to help? A big part of that is being aware of resources and being a part of a social support or somebody's social support system is, I think, a really big privilege. But I think it works the best whenever you know where you can go to connect your friends with help, and being able to start from a place that's meaningful for them. And so figuring out, like, how do I meet that person where they are to connect them with the most meaningful resource, maybe just even initiate change, and initiate some type of help seeking.
Well, I think we tend to use the internet a lot, especially during times of crisis. We want to stay informed, and so I think people rely on the internet and the news to get like what's the latest things that are going on, and so they end up being inundated and seeking out information, but try to use that strategy to seek out information for help as well. Resources, online support groups, or just, how do I deal with stress? You can always find a lot of good information on the internet. So try to balance, information seeking, staying informed with help seeking, and staying informed in that way.
Yeah, and that actually leads into the next two questions perfectly. So one of the questions is, the pandemic has caused not only more reporting and news every day, which is necessary when new information comes out, but it's scary news. How does one deal with constant information and the mental anxiety that comes with this? I feel like I'm constantly worried, waiting for the next bombshell news report, and overwhelmed with information. Any tips would be great in this new day and age.
Yeah, part of that requires some self-discipline to not, allow yourself to look at the next story and the next story and the next story and the next story. So you do have to have some times when you're not going to do it. You may have to put yourself on some kind of structure where you're only going to look at 3 stories a day, or going to only look at the news once a day or once every other day. I do think it is important to stay informed, to know what's going on, but if you continue to look at all the negative things that are going on, you're filtering the information and just giving yourself all the negative, worrisome information, instead of also looking at stories of hope or just normal day-to-day things that we all do. So it's really either setting up a structure for yourself, or really trying to balance that information so that you're getting other types of information in as well.
Yeah, I think we often talk about boundaries with others, but sometimes we forget about boundaries with ourselves, and how that can influence our own self-care. And so the next question is, what are some strategies to reduce mental stress? To be specific, strategies to help with feelings of being overwhelmed and worrying.
Okay, so I want to go back to, your own personal stress profile, or what you had say, what we think, what we feel, what we hear. So you have to think about it in terms of, what is it that I need for myself? So what strategies can I do for my physical symptoms? What strategies can I do for the cognitive, which is the worrying, feeling overwhelmed? So you can look for strategies for each thing, but we really think of the mind and the body, right? And so the cognitive stuff, the mind stuff, the worrying, feeling overwhelmed, one of the things that you can do is to try to, if you find yourself worrying too much, like for example, some people worry and can't go to sleep, like they're at night, they're worrying. You set aside a time just to worry, right? So that you're not worrying all the time. So you basically say, okay, I'm worrying, but you know what? I'm not going to think about that right now. I'm going to wait until 4 o'clock this afternoon, and from 4 to 5 is going to be my worry time, right? The other thing you can do is just write down the worry, write it down so that it's on a piece of paper. Don't keep going and reading the paper over and over again, because that's what's going on in your mind. So it's a way to just get it out of your mind and onto something tangible that you don't have to. You can say, okay, I wrote that down. I'm not going to think about it. It's there. I can come back to it if I need to, but I don't have to keep thinking about it. So it's being able to have some of those behavioral cognitive controls. And then for the physical part, we have relaxation. I noticed that there was a link to some little mini meditations or something. So I think that being able to breathe, we forget to breathe sometimes. I always tell people, when a little animal gets scared or when you get startled, you hold your breath. right? And so pay attention to whether you're even breathing. And that's a way to help calm your body down, is to do some breathing exercises and some relaxation or meditation type exercises. Music, calming music is helpful, or maybe you need upbeat, happy music, right? So that's a way to help manage some of the stress as well.
Yeah, I love the individual nature of some of those strategies, and we'll link to the relaxation room in the comments on social media and YouTube. For those of you who haven't seen the relaxation room, where you have access to some of those meditations, and I think one of the strategies specifically that you mentioned about like scheduling time to worry or to feel whatever it is you need to feel. That's a strategy that I've used with several students before for care team. And I think what I've seen, over the course of time is I'll say like, when can you schedule your hour to worry? And they come back and they're like, I don't have, like, I did it once, but like, I need that hour to do something else. And I was like, okay, so let's shorten it to 30 minutes then. And then they come back and they're like, I didn't need it today. And so they find that they can fill that hour with something else. After being able to kind of have that, giving themselves that freedom to worry almost allows them to take back some of that time.
Yeah, and then I also think that, we talked about kind of balance and not just focusing on the negative things that you need to deal with, but replacing those with some positive things. So exercise, music, like some of the things that can bring positivity into your mind and your physical body. So scheduling time for those things also, like maybe after every hour you need to do 10 minutes of exercise, or I'm going to stop in the middle of the day and I'm going to listen to some music, or I'm going to relax. So being able to work out a schedule so that you're incorporating some of those things that are going to help keep your mind and your body calm.
Yeah, in our office, we often refer to those things as our non-negotiables. So we all have those things that keep us whole and keep us grounded. But when we are stressed and overwhelmed, oftentimes those are the first things we put off to the side, because it's the things that we feel most comfortable with. It's the things that we know that we can always come back to, because it's this skill set that we feel really confident and competent with. And so when we're pressed for time, it's easy to say, okay, I'll just exercise. I'll start exercising again next week. But oftentimes it's those things that we would maybe spend 30 minutes to an hour on that buy us time in terms of our energy stores. And so I think that's really important to do some reflection around what are my non-negotiables. And then in these periods of time where I am so stressed and feeling so many different things, how do I protect those instead of putting them off to the side, so that way we can focus on being whole and working towards being whole, even in the midst of what feels like a chaotic time. So the last question that we have is, how can a person get counseling via Zoom or other teleconferencing? Is this a reliable, secure, and beneficial way to do it?
Yeah, so they have different platforms for telehealth or telecounseling, and they do have HIPAA, versions of those that are HIPAA compliant, so that they are secured. UNT Health Science Center has a HIPAA compliant Zoom telehealth program that we utilize. And so I have friends that are psychologists in the community that also are doing that, doing telehealth. And so the whole field is very focused on platforms that are secure and safe. And but if you contact someone, you should ask them. That's a really good question to ask. What are you doing to make sure that this is private and secure? So it's also available via telephone. So we are doing right now in my practice, I have a lot of older people who are not comfortable with technology, or that don't have the resources to have the technology. And so like maybe they don't have a secure internet system, or that's going to work well enough to be able to do something via like a Zoom appointment. So I just call them and we have telephone conversations. And so that's another way that we're providing counseling during this time, especially.
think that's definitely the common trend right now. And I think what's really neat, I know that even in just doing presentations with students, like around suicide prevention, I've noticed that many people feel almost more comfortable asking questions in a virtual platform or being more vocal on a virtual platform. And so I think in some ways, it has created an additional level of comfort for some, and just easier access to some trainings or resources. For our HSC students who may be watching this, we just released our new My Student Support program this past week that is completely telehealth based. And so you have options to receive telehealth counseling and mental health services through phone, video chat, and just regular text feature through the My SSP app. And all of that is completely confidential from the institution, and is unlimited. So you can use that for either in the moment counseling. So if you're feeling really overwhelmed and it's 3 o'clock in the morning, you can hop on and talk to a counselor right then. Or you can have scheduled counseling sessions with the same counselor at a normal, like regularly scheduled time. And those are also unlimited, as long as there's clinical need. So I think that it's been really neat to see how people have been innovative during this time to figure out how do we increase access for people with services, and how can we make sure that people still have access to mental health support as well.
Well, I love the flexibility of it, because it breaks down the barriers for people to be able to actually come to an appointment, but it also allows me to be more responsive. Like you were saying, 3 in the morning or whatever, it allows me to be more responsive to the people in my patient panel to be able to meet their needs when they need it.
Absolutely. And again, we'll link to some additional resources in the comments for anybody who's watching who maybe wants to check out what other resources may exist. I'm a big believer in providing our students with resources to meet them where they are. And so if you don't feel comfortable coming in to see the care team, that's totally fine. If you feel more comfortable with a texting hotline, perfect. We can get you connected with that phone number. I think what's most important is that we're able to match resources to exactly where you are to provide support. Dr. Franks, as we wrap up, is there anything else that you may want to share, recommendations, just as we navigate just this really unprecedented time between, I think our country is just under a lot of stress right now, and people are feeling that.
I think the only thing I would like to really emphasize is being able to find someone that you can really confide in, that you feel safe, whether that's a person that you're familiar with, that's a friend or a family member, or whether you reach out to a counselor. Please find someone that you are able to talk to, that you're able to reach out to be able to process what's going on, and someone that you can feel safe to express how you're really feeling and how it's really impacting you. That's going to be critical. And be able to reach out. Dr. Mire, you're talking about people reaching out and noticing others. Be able to think about how this is impacting your coworkers and your peers and people around you, and be willing to reach out to them also to provide support as well.
I think that is the perfect summary of, we want everybody to have a safe space, and in the same breath, I think my challenge to everybody would be, how can you be a safe space for others? Because we're not meant to go through this world alone. And so how can we create connection in a time where I think so many people are feeling isolated? And so for everybody who's watching, thank you. And thank you for submitting questions. We'll make sure to link to all of these different resources. And then if you have any questions, we'll put the OCC contact information in the comments as well. If we can connect you to any resources, we would be happy to do that. So thank y'all. Thank you, Dr. Franks.
You're welcome. Thank you for